Cataract is not a disease. It's essentially a technology. And then that's actually very, very frightening to feel like a disabled person for half a year or even a whole year. What if I can't see after the surgery?
Friends, here are 5 tips from professionals for professionals.
Dear friends, what advice could I give you when you're about to have cataract surgery? First, you should remember that cataract is not a disease. Cataract is a normal age-related process. And since it is primarily generated and shaped by the patient's age, unfortunately, if you are already experiencing vision deterioration due to cataract today, it won't get any better tomorrow. Therefore, if you want to see better starting today, you need to make up your mind, gather your strength, perhaps some financial resources, and go ahead with the surgery today. So what advice would I give you regarding the necessity and possibility of cataract surgery? Advice number 1, don't be afraid, because cataract surgery nowadays is essentially a technology. In the past, cataract surgery was primarily about the surgeon's skill, experience, knowledge, and qualifications, but now it's about technology in skilled hands. Of course, the more qualified the surgeon, the lower the risk of complications. But technology plays a very, very significant role. Second, don't delay. Cataracts can cause complications and can provoke the development of other diseases, such as glaucoma or diseases of the central area of the retina. And that is very, very serious, because these diseases can lead to blindness, permanent blindness. Third, don't believe the myths and fairy tales that after surgery you'll have to feel like an invalid for half a year or even a whole year. Nothing like that happens. You can return to your normal daily life almost immediately after the operation without any restrictions. Fourth is the choice of the artificial lens. If you want to have vision without glasses after the surgery, without needing glasses for distance or reading, and to be independent from such things, then you need to have a multifocal lens implanted. If you require the highest possible quality of vision, then you should consider whether it might be more appropriate to have a monofocal lens implanted. But of course, all the major global leaders in artificial lenses are now represented on the Ukrainian market. So, whichever lens you choose for yourself, in a modern, reputable clinic, you will get the best possible result you are aiming for. And fifth, probably the most common fear among all patients is, what if I can't see after the surgery? Well, I'll be absolutely honest with you. In my practice, I operate on up to 80 patients every week. So all the patients are happy, everyone is doing great, everything is fine. And even before the surgery, it is always possible to predict the risks. Therefore, when you consult a surgeon or a doctor, your doctor will definitely tell you whether you should be concerned about having eye surgery in your particular case, or if it's better to have the surgery today, so that it won't be too late tomorrow. We are always very happy to share information and to welcome you, our dear patients. See you soon.